Today I'm going to talk to you about lip filler. It's one of the most popular treatments that I do in my clinic. It involves using a product called dermal filler. Now that contains something called hyaluronic acid, which is, think of it like your normal skin's moisturiser. What it does is when it's injected, it takes around about 2 weeks to reach its full effect in your lips. Depending on the person in front of you, depends on the product that you use. For instance, if it's a more mature person in front of you, you want to use a softer product to build hydration and softer volume, and take it in stages as you'll have more dehydrated lips. And if it was a younger person, you would use a more firmer product that creates a greater volume, depending on the person's wishes. Of course. Now it's a super sensitive area, so I do advise you to take paracetamol before the procedure, and I try to distract you with stress balls, for instance, that you can squeeze, but it can cause some discomfort whilst having the procedure. You'll be good to know that the dermal filler that I prefer has local anaesthetic in, which once it's injected it will make the procedure more comfortable. Now the effects will last anywhere between 12 to 18 months, and you can do a number of techniques depending on your wishes. So for instance, if you want a more defined lip border, you can inject along the border, but if you want to create greater volume in your lip body, then you inject more in the lip body itself, not affecting the lip definition around the border. I think it's important to address the common misconception that lip filler can look fake. I've had lip filler, I don't think it looks fake, but also that if you are worried about having something like overfilled lips or duck lips. Now why that happens is because the dermal filler that's been used has attracted too much fluid, and whether the technique is when it's been injected, it's injected and allowed to move between your lip tissue itself and then go above the lip tissue, giving almost like a donut effect around the lip. Now the technique that I use means that it stays within its fascial compartment, meaning that there shouldn't be any kind of leakage or migration movement for that lip filler. It's all down to technique. Now if you have any questions, then get in contact